Hospital epidemiology, healthcare associated infections, HAIs, or formerly called nosocomial infections. This is a big deal. It's kind of a subset all on its own. Epidemiology, the study of how microorganisms move through a population and diseases move through a population. How do they move through a hospital population? Healthcare associated infections. All right, so we're looking at those very carefully. These patients are very susceptible to different infections. So healthcare associated infections are any infection that's acquired in a healthcare setting. Could be acquired by a patient or our healthcare workers. A lot of talk now about protecting our healthcare workers who are working in these hospitals and keeping them safe. If they get a disease during their job of caregiving in a patient, then that is a healthcare associated infection. And we're all looking at keeping those numbers down. We do need to classify them. Exogenous, HAI, so exogenous, that's outside, right? You get it, you acquired it in the healthcare environment. You didn't bring it with you. Let me contrast that with endogenous HAIs. Endogenous, inside, right? Endo. This is what happens when a patient comes into a healthcare setting and something while they're there allows them to get a disease, but they brought in the microorganism with them. So part of their normal microbiota within the patient, because they're in the healthcare setting and because they're facing issues dealing with disease and that kind of thing, it becomes part of their normal microbiome, becomes an opportunistic pathogen. An endogenous HAI, this is when a patient gets a yeast infection while being in the hospital. They were given antibiotics, and while they're in the hospital, antibiotics get rid of the bacteria, but the yeast overgrow. That would be considered an endogenous HAI. It occurred while the patient was in the hospital, so it's an HAI, but because they didn't pick up the yeast in the hospital, it's considered an endogenous HAI. Some of our patients with C. diff, Clostridium difficile is a big deal with healthcare-associated infections right now. It is a endospore-forming bacteria that causes a diarrhea, extreme diarrhea, and can lead to a more severe disease after that. But we normally carry a little bit of Clostridium difficile with us, C. diff with us. So it's possible a patient can come in with some C. diff, they're given some heavy-duty antimicrobials, and their C. diff that they brought in with them leads to a diarrhea disease from that. And there's the more severe form is pseudomembranous colitis, is that right? You'll fact check me on that. So that is a case where the patient brought that in and then suffers, but because they're in a healthcare setting, it's considered a healthcare associated infection. Now, contrast that with exogenous HIIs. Say this patient that came in and got an endogenous HAI and is now suffering from a C. diff infection, say he is roommates with another guy. And because this patient has diarrhea, there is some contamination, and the second patient, his roommate, picks up C. diff because of contamination from the first patient. The second patient got an exogenous HAI with the C. diff because he picked it up while he was there. It wasn't his own bacteria that caused it. He picked it up from exposure while he was there. Exogenous, if volunteers come and they spread a pathogen from room to room, that's an exogenous HII. If equipment spreads pathogens from room to room, that's an exogenous HII. They picked it up while they were in the healthcare setting. Now, a subset of this is that iatrogenic, and we defined that earlier. Iatrogenic is also a HAI. If it's a healthcare-associated infection that happens as a direct result of medical intervention. You inserted a catheter and then it became infected. That's an iatrogenic HAI. If there was a mistake made in surgery or any sort of something like that, that is considered iatrogenic. It's a direct result of medical intervention. So say this patient gave the C. diff to his roommate, that's not iatrogenic. If the healthcare professional, the nurse, was treating this patient and then was treating the other patient, that would be considered iatrogenic. It's a direct result of medical intervention. All right, so classifications of hospital epidemiology. Oh, just more pictures from that to help you remember. Endogenous, you brought it in with you and got it. Exogenous, you got it from the environment. Iatrogenic, something a healthcare professional did or gave you, a drug, caused the HAI. Okay, what else do we need to know? HAIs are such a big deal because in the hospital we have a lot of things going on that make them uniquely susceptible to these types of infections. We have patients who are immunocompromised. They are sick and their immune systems are taxed already, and they're in a healthcare setting. That makes them susceptible. We have a lot of these patients with a lot of different diseases all in one place. That makes them particularly susceptible. We have patients, staff, equipment moving between patients and coming in contact with. That makes us susceptible. So this is why HIIs are a big deal. This is why they're telling us right now, if you have a mild case of this COVID-19, if your symptoms can be managed at home, stay home and manage the symptoms, keeping you out of that environment when you're already sick, when there's so many other microorganisms going on, is the best thing. Hospitals and other healthcare facilities are at big risk of transmission of microorganisms. All right, so how do we prevent it? And this is a big deal. Prevention is a very big deal. We need to wash our hands. Wash our hands, wash our hands, wash our hands, wash our hands. We've learned that in this class, and now we're seeing that play out. Hand washing is the #1 thing we can do. Proper disinfection, proper aseptic techniques, isolation of risky patients. All of this is to protect our patients the most.